Welcome, welcome. This is Nicolette and it's Healthy Wandsworth on such a sunny Wednesday morning. What are you doing to celebrate the sun this morning? How are you going to celebrate it with health and well-being? I am your human vitamin today and I'm going to be talking to Flora Gingivitis. Yeah, I got to get it right. It's important. Names are important, aren't they? And she is a principal dentist at Covent Garden Dental Spa, a bespoke general specialist and cosmetic dental surgery in Covent Garden. Such a lovely central place for people to come to, even if they live outside of London. And Flora has been a finalist for many accolades, I tell you. And that represents how she serves her clients. Let me tell you what they are. Best Patient Care 2014, Best Charity or Community Project 2014, Best Treatment of Nervous Patients 2013-14. Is that you? Best Marketing 2010, 11, 13. Best Patient Care 2011 and Best New Practice 2009. I have to say hello to Flora. Welcome.
Thank you very much for having me, Nicolette.
It is my pleasure. Thank you for being here. All those accolades. You've been doing good.
I think we're doing all right.
Yeah.
We're working hard at it all the time.
Well done. Well, I want to find out more about you, and I'm sure my listeners do as well. So let's take a moment just to listen to Akon featuring Eminem with Smack That, and we'll come right back.
Wandsworth Radio.
That's Smack That, Akon featuring Eminem. Eminem. Do you like Eminem, Flora?
I do. I grew up with Eminem, so I've always liked Eminem's music.
Okay. So we're here talking about dentistry. I think some people would think it's a bit of a weird thing to talk about. No one really talks about dentistry, do they?
Yeah, I think it's a topic that people tend to shy away from.
Yeah, and this is exactly why I want to bring it to the forefront. Anything forbidden, I want it out there so people are not afraid of it. Fear, no fear.
Okay.
So that's why I brought you in as an expert and a professional in your field to tell us about your dentistry, your dental practice, where it began, why you do it. So I'm going to fire a question. Why dentistry?
It's something that I grew up wanting to do from childhood, I guess. Unfortunately, we have to decide by the age of about 16, 17 what we want to do when we're filling out our UCAS forms. And so from the age of 17, I knew I was either going to be a doctor, a dentist, or a pharmacist, something in the medical profession.
Mm-hmm.
And I chose dentistry. I wanted to do something different because at that time, very few people were actually going for dentistry. Everyone was going for medicine.
Right, okay. And then what journey did you have to take to get to where you are now? Qualifications, hindrances, sacrifices?
It was a 5-year degree.
Wow.
So that was a long time, but I was still young and I loved being at university. I studied at the University of Manchester, should I say.
Yeah.
And I loved that. There were 4 universities on campus and it was a great student life.
Mm-hmm.
So that was 5 years. The big sacrifice, I guess, was it was quite a taxing degree to do. So everyone else would have 3 months summer break and would have 3 weeks and then would come straight back into exams.
Wow.
So summertime was about studying to get ready for your exams at the start of the year.
Yeah,
so.
and did that start from the very beginning? At the end of year 1, you got 3 weeks for year 2 and so on?
Year 1, I think we got the full 3 months. And then year 2, maybe we got like 1.5 months. But once we got into year 3, we were just having 3 weeks off and that was just to study.
How did you find that?
It was hard work. It was hard work, but it was worth it. When you graduate and you've got your certificate in your hand and you've got your qualification, it was worth it.
Yeah, and I'm sure because you've got the comradeship around you, the people who are doing the same thing and on the same journey, you come together and find your little cliques, don't you?
Exactly. So it was well worth it.
Good. And were there many women studying when you were studying? May I ask how long ago that was?
I graduated in, I have to count the years back now. I graduated in 98.
Okay.
Yeah. Back in those days, there were fewer ladies than there were guys studying dentistry. That's changed a lot now. You've got a lot more women studying dentistry than you do males. And I think it's because people tend to find that dentistry is a very female-friendly type of profession to do. It's compatible with having children and You can work part-time, you can dictate your hours. So it's a little bit more of an easier profession for ladies to do. So you tend to find a lot more females are going into dentistry these days.
Is that in parallel with being a doctor? Is it similar with that kind of pattern?
I think once you graduate as a doctor, you tend to find that you're working longer hours.
Right.
Especially if you've got house jobs and stuff like that, you work really long hours. But as a dentist, you can work like 2-3 days a week and still earn a reasonable income. And the hours are more flexible because you tend to be working in practices where you can dictate what hours you want to work.
I see. And at what point do you think women clicked onto that?
I'm not sure, but I know that if you go into a dental school now, there are a lot more girls than guys in the actual dental school.
Right. There are a lot more girls now than guys.
Yeah.
Okay. What's the journey been like for you as a woman in the dentistry industry? Before we talk about your actual wonderful spa, how's it been building the business? How did you build the business? And did you get much resistance? Was it easy? Did gender even play a part? Too many questions?
I think one of the things I would say is, and I still experience it now, I can be a bit wet behind the ears about certain things. And if people know that you're a bit wet behind the ears, you could find that they might take advantage of you. So it would maybe take a male perspective to say, actually, you could get that for half the price, or you could, do it a little bit better. When it comes to just little things like, let's say, developing your website or getting, just little things like that. Okay,
but that has nothing to do with gender. That's just people abusing kindness and naivety, perhaps?
Possibly, yeah.
Okay. Tell me about your practice, Flora. Why bespoke?
I wanted to do something different. I wanted to set up a dental practice that had a unique selling point, something that people would talk about. So if you come to my practice, I want you to leave and go, oh, wow, and then talk about it so that, it spreads the word. And that's how we've actually grown. We've been going for 7-8 years now, and most of our patients come from word-of-mouth referrals. So I wanted to create something that was bespoke and that was unique and that would give my patients the best quality dentistry that they deserve. Okay, well, let's find out more about what exactly it is that you offer and what makes you different from the competition out there. We'll do that in a few moments. Take a moment to listen to Calvin Harris and Summer. Oh my gosh, how appropriate is this song? Summer, summer, summer. Summer, Calvin Harris. How are you finding the summer, Flora? Oh, I'm really enjoying it. I love the summertime. I grew up in Africa, so I'm not used to the very cold weather. Yeah. So as soon as the sun comes out, I'm like a flower. And
that's a nice analogy. Just blossoming and opening up slowly with the heat.
And I'm very, very happy. So it's a bit hot today, though, but I can take it. Yeah, I won't complain. I'm not going to complain.
No, please don't. I hear people complaining. And then when it's raining and snowing, people complain. And my question is, at what point are you happy?
Yeah. No, I'm happy with the sunshine. Thank you.
Okay. So tell me about your dental practice. What's it called?
The Covent Garden Dental Spa.
And where is it?
We're based in Covent Garden on Neal Street.
Oh, that's a lovely place to be.
Yeah, it is. It's great. Loads of shopping and really nice. It's in 7 Dials. Okay. So we've got a really nice 7 Dials village feel and everyone knows you, they'll know, oh, there's the dentist and, it's a really lovely place.
Was it an easy venue to find when you were looking?
No, it was quite difficult, actually. I think it took me maybe 3 to 4 months before I found the space, maybe even longer. Wow. I'd say at least half a year before I found the space that was appropriate to actually set up what I was looking to do. And but then once we found it, then all the legalities, etc., then doing the actual work took from July through to November.
Oh, wow. So that's not too long then, is it?
Yeah, doing the whole refurb.
The whole thing. And so you were able to launch by the new year at least?
Exactly. We launched on the 5th of November, 2008.
Wow, exciting. So what do you offer?
Everything to do with teeth. We start off with the general dentistry. So we're doing checkups and hygienes, checking people's teeth. Mainly focused on preventative dentistry. Then obviously all the fillings and restorative work as well. And then we also offer the specialist treatments, such as orthodontics, which is straightening the teeth, implantologists for anyone who needs an implant placed in. We also offer periodontology, which is treatment of the gums for people who may have gum problems. These are advanced gum problems. Oral surgery for extraction of complicated wisdom teeth. And endodontics, which is specialist root canal treatment. So I've got 5 specialists that work with me as well.
Okay.
And then obviously all the cosmetic work as well, like teeth whitening is very popular. We've got patients who come in for smile makeovers, veneers and crowns. So that's a full array of the treatments that we offer.
Yeah, very nice. What is preventative dentistry to you? Because that's what you focus on mainly, you said.
Yes. I think it's very important for people to understand what they can do to prevent problems from happening. And a lot of that is mainly focused around visiting the dentist once every 6 months, the dentist and the hygienist, so that we're giving patients advice on what they can do to prevent problems from happening.
Okay. And you've got a membership, which I was quite excited to read about, because I don't know of any dental practices that do membership, like it's a club. So can you tell my listeners and myself about the membership and what that is?
So we've got a membership where patients pay £20 per month, which is less than your telephone, your mobile phone bill basically. And you're paying £20 a month. That entitles you to 2 free checkups and 2 free hygiene appointments in the year. And then you also get other little benefits as well, like teeth whitening. You'll also get 10% discount off any dental treatments that you require as well. So the whole idea is you're coming in once every 6 months. You're not leaving things to fester and get worse before you come in. So because you're coming in, we can address how you're cleaning your teeth, brushing your teeth, your diet, providing any treatments that will help prevent problems from happening in the future. And then we actually have a good relationship with our patients because we're seeing them every 6 months as well.
Of course.
And it's affordable. That's the most important thing.
That's what I was going to come on to, because that's the incentive to get people to come to you. Which brings me on to a question that I am a little confused on. People are often a bit scared to go to the dentist, and they're even more reluctant when they have to pay for high costs. So what is the difference between the NHS and the private? Do you do any NHS? And how does it work? I mean, I know that NHS means you don't pay for it, you've already paid for it. But how does it work within the business?
We don't offer NHS dentistry at the Covent Garden Dental Spa. It's a bit tricky. NHS dentistry is an affordable treatment, I guess, so there are people who still pay for NHS dentistry, but the amount that they pay is very small.
Right. So they get help.
Exactly. Their treatments are subsidized, I think is the best way to put it.
Right.
We offer private dentistry, so the fees are higher, but that means that we've got more time to actually spend with our patients for a checkup. I can spend time with you. I can find out what your problems are. I can do all the necessary investigations in a reasonable amount of time.
Sure.
Whereas because the NHS, the fees are less, people can't really afford the time to spend with their patients. They can still get a good level of care on the NHS, but I believe that because we're doing it privately, we can provide patients with a better level of care.
Right, I see. Okay, that answers it for me. Thank you. Also, one of the things that I read was a radiograph. What is that? You offer a radiograph free. So I was like, oh, what's that?
It's not necessarily that the radiograph is free, but the radiograph is included in the cost of the examination. All right. So when you come in for a dental treatment or a consultation, you may need to have some radiographs taken. A radiograph is an X-ray of your teeth. So when I look at your teeth, I can look at them and they can look perfectly healthy. But then once I take an X-ray, I may detect decay from the actual X-ray.
I see.
All right. So depending on what you present with and what your problems are, that will dictate how many X-rays or radiographs I need to take for you.
I understand. It's so clear and obvious when you explain it so well as well. I had a look at the sort of price ranges, and I saw that £170 for a cosmetic filling. What is a cosmetic filling?
So you get different types of fillings. You've got the silver fillings, which are the old mercury fillings,
Right.
or the old silver fillings, which contain mercury in them. I haven't done those for, I'd say, a good 8-10 years now.
Okay.
And you tend to find people are now shying away from doing them. Unfortunately, they're still provided on the NHS because it's a more cost-effective way of providing dentistry.
I see. Is there a health implication?
They say that the mercury has got some effects on the central nervous system.
Same with fish, right? Okay. It's the
Yeah.
same, yeah.
So you tend to find that people are shying away. And there's some countries in the EU, Scandinavia, they just don't even touch mercury. They just don't provide it at all.
Right.
They won't provide the amalgam fillings. So we're doing cosmetic fillings. They're cosmetic because they're white. It's a white composite filling, and it looks like your own tooth. So when you laugh out loud,
yes.
it's not one of those things where everyone goes, "Oh, she's got a mouthful of metal,"
Yeah.
because no one will be able to see your cosmetic fillings.
And so you mentioned that whitening was one of your most popular. Is that your most popular treatment?
Do you know what? It used to be very popular. We used to have people calling up going, I want some whitening, please. I want to whiten my teeth. We still get the phone calls, but I'd say if we had, let's say, 20 inquiries in a week, for example, I'd say at least 12 of those would be for whitening. This was when we first started in 2008.
Right.
But now a lot more of the inquiries are about, I'd like to come and get my teeth cleaned. So the mind frame has shifted a lot, where people aren't so, I want white teeth. They want clean teeth and healthy teeth.
Right.
So that's a change that I've noticed since we first started in 2008.
Okay. And how much is a checkup?
A new patient consultation is £100.
Okay.
If you join the membership, it reduces to £50. So
that's a £20 a month membership.
Exactly.
Right.
So you still have to pay for your first consultation, and then after you've had your first consultation, that's when you start paying the membership monthly. So then those contributions pay towards your next checkup and your next hygiene appointment.
I see. And what happens in a consultation or the following follow-up appointments?
In the consultation, that's when patients come in and they present with whatever their problem is. They'll come in, I've got toothache, or can you just check my teeth, or I've broken a tooth. And then that's when we do all the investigations, take the necessary x-rays or radiographs,
Right.
come up with a diagnosis, and then present the patient with treatment options, providing pros and cons of the different treatment options, how much is everything going to cost, and then the patient can decide which treatment is going to be best for them.
Okay.
So that's what happens in a consultation.
In the consultation. I'm curious to know what makes you different, and why that consultation is different from anybody else who's doing, who has a dental practice. But we'll find that out after this ad break.
Wandsworth Radio.
What makes you different, Flora?
It's not necessarily what makes me different, it's what makes my practice different.
Okay.
So when I was designing the dental spa, I designed it in a way that I looked at all the things that patients don't like about visiting the dentist. So I did some questionnaires, and I asked some patients, and the main things that came up were the sound that you get when you come to the dentist, the smell, and then the decoration. So I addressed all of those bits and pieces. And firstly, if you come into the dental spa, the decor is very warm colors. We've got wooden floors and nice, warm, earthly colors. And when you first step in, you think you're in someone's lounge. You wouldn't think that you are in a dental practice that's actually going to be doing dentistry.
Mm.
So the first thing is the actual look and the appeal of it, and then we use aromatherapy as well.
Right.
So as soon as you come in, you've got these lovely aromatherapy smells that help you to relax, so you don't have that surgical smell that people normally associate with going to the dentist.
Yeah, exactly.
And then the other thing is we always have nice relaxing music. So we've got this real spa feel going on. So it's completely different to any other dental practice that you'll ever go to. And because of that, that just makes us a cut above the rest, I'd say.
So are you suggesting that there aren't any other dentists like that around? That have you researched? Have you checked out competition to see what they're doing?
I have. I've looked at other practices that call themselves dental spas, and I don't think there's anyone that actually offers, unless there's someone that's come up recently, but I don't think there's anyone that actually offers it in the same way that we do.
Right. You were shortlisted, finalist. Which is really good, for Best Treatment of Nervous Patients 2013 and 14.
Yes.
What did you have to do to be acknowledged for that? And how do you ensure that your patients are feeling, I love dentistry, I want to be here?
We do certain things that make sure that our patients are comfortable. So obviously starting off with the few things that I mentioned to you before,
of course,
like the whole decoration and the smell, and but then we also offer other things like acupuncture, which has been said to help relax patients, and we also do hypnotherapy as well, which helps to allay the fears that patients may have about coming to visit the dentist. And we offer other treatments as well, like sedation, and this is all to do with helping very, very nervous patients. The other things we do are we'll have music selections for our patients. We can also get patients to select maybe like a movie that they may want to watch during their actual treatments, for long treatments.
Really?
So we do lots of little different things just to make sure that our patient is comfortable when they come in for their dental treatment.
And I'm thinking immediately of children, because when even though we're adults, often when we're fearful, we go back to our childlike state. And so children themselves, do you work with children? Yes,
we do. We've got a handful of children. You'll see on our membership that if a parent is a member of the dental spa, their kids can come and actually have their checkups and little, what we call kiddie polish, for free. And we do see a handful of kids, because when we're central, we're not residential, we don't see that many,
of course,
but when we do, we always love having the kids over, and we just have lots of fun with them. It's all about having fun and making sure that they love coming, so they'll be like, oh, when are we going to see Flora again?
Yes, exactly.
So it's just about making it fun so that they don't have that, grow up with that fear of coming to the dentist.
Yeah. And I'm thinking that, did you hire all of your staff individually?
Yes, I did.
Yeah. So what were you looking for in each person in order to represent your business?
They each come with their own individual qualities. I think one thing I learned from the very beginning was always hire people that you could be friends with. Not necessarily that we're going to be best friends, but that they could qualify as a friend. They've got the personality of somebody who would be a friend, because you spend so much time with them. If I think about the girls at work, they, above anybody else, my partner, my family, they're the people that I spend the most time with, so we have to get along.
Yeah. And what are the hours of your business, your practice?
We can work up to 12-hour shifts, just depending on how busy we are on the day.
Do you have a particular busy time of the year?
Yes, we do. We're going into quiet period now. So July, August tend to be a bit quiet. Our busiest period is October, November, and the first few weeks of December. But it changes all the time as well. But that tends to be the general trend. January tends to be quiet as well.
Okay. And then the other things that you offer as well are, which I had a massive smile because it really is catering for a market of people who are very interested in looking good with a smile, is brides and grooms.
Oh, yeah.
Yeah. Tell me a little bit about that.
We've got, firstly, for our members, we do what we call a bridal clean, and that applies to the grooms as well. We just call it bridal clean. It's just easier,
Yeah.
And it sounds nicer than groom clean.
Yes, it's like you're going to pick hairs like a monkey out of their skin or their teeth or something.
So we've got a bridal clean. So if anyone's getting married, we give them a free or a complimentary hygiene service where we make sure that their teeth are nice and sparkly, clean for their special day.
Is that as a member?
As a member, yeah.
Right.
So that's really important to us, and it's really nice because a lot of our patients that might come and say, oh, I'm getting married in a year, so can you please help me design my smile? I want to have that special smile. Or even if they come 1 week before the wedding, we get really excited. And then we always have patients sending us their wedding photos, and we always encourage, oh, please send us a photo of your wedding smile, show us your beautiful bridal smile or whatever. So it's really special for us.
It is special. I don't think people realise how important teeth are. To be honest, I found out how important teeth are when I had a crown. A crown is the one that you put on yourself and have to take off before you get a denture. Is that right? The crown? What's the thing where you say that the front teeth where you can take it off? And
that's a denture. The one that you take out yourself is a denture.
Okay, so I had to have that because I ran into a wall as a child, as you do. And my front tooth became discoloured. So as I became older, I eventually went to the dentist, and until I could get the actual denture made up, he gave me a substitute one, which is really inconvenient for all the people who don't all the people who don't enjoy taking your tooth out and putting it in a container and putting it in stuff to keep it clean overnight.
Yeah.
It really is. It just sort of makes you think, oh, a bit vulnerable.
Yes.
But I dealt with it, as you do.
Yeah.
I went to India, and unfortunately, the tooth broke.
Oh, no.
So I had to become very humble in a strange country with people I just met doing yoga with no tooth in the front tooth.
Oh, no.
Yeah. Whilst I was waiting for the people who were supporting me to find a good dentist, to go and get it measured, to then get a temporary one for the duration of my stay until I came back home.
Yeah.
It's extremely humbling.
Yes,
and I did not realise how important a smile is.
Yes.
Because I didn't want to smile, and I love to smile.
Yeah, you've got a big smile.
Yeah, thank you.
Beautiful smile.
Thank you. So I really do I think that's part of the reason why it resonated, of having a dentist on the show, and not just a dentist, but a bespoke dentist who really understands the issues that individuals go through. And I use the word individuals because you really do cater for the individual, don't you?
Yeah, definitely.
And that's what it's about. It's not one size fits all.
Yes.
So tell me about your hands. Sounds like a random question, but I work with quite a few dentists when I teach, and the one thing that they tell me is that their wrists and their fingers, because of the places that they need to go into, become quite either arthritic or quite tender and inflamed, and it just hurt.
Yeah.
What's your experience of that?
I get a bad wrist on my right hand, and sometimes I can get tennis shoulder as well, but it's all about posture.
Okay.
So if you can maintain a good posture, then these problems shouldn't really haunt you. But I think over a period of time, it comes and it goes. You can get a bad back or whatever. So it's always good to have like physio treatment every so often, and always good to maintain a really good posture as well. And
do they teach this as part of your training?
No, they don't. It's something that you learn, and sometimes you learn the hard way.
Yeah, of course. And is that what you do? Do you have physio when you can?
Yes, I do. And massage even.
I was going to ask, and do you massage your hands? Do you do it yourself, or do you go to someone?
If my wrist is hurting, I'll need to see a physio.
Yeah.
Sometimes even acupuncture helps. Yeah. But if it's my back, then that physio again is always good, or even an osteo. I've seen an osteo before for my back.
They are amazing.
And then just massage is good as well.
Good. We talked about the brides and the grooms, but you also do stuff for partners, and you've got a reduced rate for partners. Can you explain a little more about that?
So if you came and you joined our membership and it was you signed on to the £20 a month scheme, if your partner came and joined, then we would reduce you to what we call a couples rate.
Ooh.
And then your payment goes down to £18 a month.
Okay.
Yeah, so
Is
that's
that
our
each?
couples rate. Each,
Okay,
yes.
right. So you're saving a little bit there.
Yes.
And then it's exactly the same benefits that you're getting
Exactly.
as a £20 one.
Yes.
And then the other thing that I would love people to know about is if you're pregnant, and it's such a special time,
yes.
that you offer a maternity dental cover.
Yes, we do. So what it is a free dental cover for a year. But instead of paying nothing for a year, we just reduce your payments by half for 2 years.
Oh.
Yes. So you're just
okay.
paying half the amount, but it equates to having a whole year for free.
Yeah, sure.
Yeah, so we just acknowledge that, I guess, on the NHS you get free maternity cover. So we wanted to do something similar for our pregnant mums.
Of course. And so why would someone come to you if they're getting it free on the NHS? Sorry to pose that question. It's just come to my mind. I did not mean to put you on the spot.
No, it's okay.
It's
I guess I'm proud to say we offer a better level of service. So
Okay.
it would actually take coming to us and then going to an NHS practice and doing a comparison to actually understand what I'm talking about.
Okay, so you really are catering for the woman who's a bit vulnerable, she's a bit hormonal, she's carrying extra weight, as in the baby, and you're able to deal with all of those different things, maybe as well as a fear of actually being at the dentist.
Yeah. We like to think that more than that, I think it's important that our pregnant mums to be understand that there's so many things that could happen during your pregnancy, like the bleeding gums and, if you're feeling a bit nauseous and you've been throwing up in your first trimester, the acid erosion that could happen on your teeth. So there's so many little things that we like to address, and it's important that they keep coming to us so that we can actually point all of these things out to them and, do the preventative thing that we were talking about again, just to prevent problems from happening.
Okay, and I'd love to explore what the implications of not taking care of your teeth are. I mean, you've just touched on a couple of them. So after we listen to Emily Sunday and Next to Me, we'll just step into that room.
Wandsworth Radio.
Welcome back. You're listening to Nicolette Healthy Wandsworth, your lovely human vitamin pill, on a Wednesday morning. I'm here with Flora, who owns a dentist practice, and it's a really good one. It's bespoke and it's geared completely for you. We're talking before about what would happen, why women who are pregnant should come to you, which led really nicely onto preventative. So I'd like to know at this moment what happens if you don't look after your teeth?
If you don't look after your teeth, then you tend to have problems like gum disease is one of the main ones that people end up suffering from.
What's the symptoms of that, Flora?
Bleeding gums, painful gums, swollen gums. But bleeding gums are that's the main complaint that people come in with if they've got problems. Mobile teeth, if it's really bad, your teeth start to wobble around, they could fall out.
Can you get bleeding gums without having gum disease? For example, you've got something lodged in, you've taken it out, and now the gum is bleeding a bit for whatever reason. Do you have, if you have bleeding gums, does it mean you've got gum disease?
If your gum is bleeding in that particular area, then it becomes localized gum disease. Even if it's just for that day or something, it's localized.
Right.
So it's what we would call gingivitis. Gingivitis is inflammation of the gums. As soon as you've got bleeding, then it's a sign of gingivitis.
Okay. So please continue. You were just suggesting what happens when you don't look after your teeth.
Well, gingivitis, which is inflammation of the gums. Periodontitis is when you start to lose the bone that supports your teeth. So that's the more advanced version of gingivitis. And this is all bacteria-based. The bacteria is now eating away at the bone. So that's when you start to get the mobile teeth, because your teeth don't have that bone support that they used to have.
Right.
The other things that you could have, decay. So if your teeth are starting to rot away because you haven't been to a dentist, you haven't had the necessary advice for good diet and brushing and cleaning, then you could end up with decayed teeth as well.
Right, okay. And how can people therefore prevent all of this? I know they come to you 6 monthly, they have a yearly check, etc. But I'd love my listeners to get 3 easy tips to be able to keep their teeth healthy and their gums healthy.
One of the main things I'd say is you've got to floss. And I once knew this hygienist who used to say to her patients, floss the ones you want to keep. Which I think is
all
great.
of them.
I know, exactly. So, because there's some people who'll come in and they'll say, oh yeah, I do floss, but I just floss the front ones. And she'd go, that's great. Keep flossing the ones you want to keep. So I'd say definitely flossing is very important. One of the main tips that I always give my patients today, all the time, is floss before you brush. And that's one thing that people don't do.
That's correct.
The order, that people do tend to get the order wrong.
Okay, why?
So always floss before, because when you're flossing, you're dislodging all the food and debris, and then you want to flush it out, and brushing your teeth will help to flush that all out.
Okay, it's kind of logical, isn't it, really?
Exactly, but so many people get it wrong. And then after you've had a really good brush, then that's when you use a mouth rinse. And you've got so many different types of mouth rinses. You'll either choose a mouth rinse that's for to help treat gum disease, or a mouth rinse that helps to keep the teeth stronger. If you've got sensitive teeth, you'll use a different type of mouth rinse. So it just depends.
I understand that all the mouth rinses should have fluoride in it.
If you've got decayed teeth,
right,
or you've got sensitive teeth, then I'd recommend a mouth rinse with fluoride in it.
So they don't have to have, you can have a mouth rinse without fluoride.
Exactly. And then you've also got some mouth rinses that are very medicinal for the gums. They tend not to have fluoride in them. So it just depends on why we are prescribing a mouthwash for you.
Okay. So I think that was number 1, wasn't it?
That was tip number 1.
Yeah.
Tip number 2, I would say, is always brush after you've had your breakfast. So a lot of people wake up first thing in the morning, they want to do the first thing that they want to do in the morning is grab their toothbrush and their toothpaste and then brush their teeth.
Yes.
But then what happens after that? You go and you have your breakfast, right? So then you've got all that food from breakfast, your cornflakes stuck between your teeth. And then you go and you have your lunch, and then you add your sandwich stuck between your teeth. And then you go and you have your dinner stuck between your teeth. You brush your teeth just before bedtime. So you've now had all this plaque sitting on your teeth over that long period of time.
Right.
Whereas if you brush after breakfast, then you know that you're not having plaques sat on your teeth for too long. So then this will help to prevent decay from developing in between your teeth.
Okay, and can you brush before and after?
You could do, but then that now falls into a realm of overzealous brushing, because you don't want to over brush your teeth as well.
Okay, so could you just put some toothpaste in your mouth, swish your mouth about and spit it out, and then go and have breakfast and then brush after?
Oh, why would you want to do that?
I don't know. I think some people don't like the idea of smelly sleep breath. That's as simple as that.
I guess if you're just going to go to the kitchen and have breakfast,
It doesn't matter.
Yeah, well, yeah, I guess the main thing is just to make sure that you could brush, maybe do a quick brush before you have your breakfast to get that morning taste out of your mouth, and then have your breakfast and brush your teeth afterwards. You could do
electric toothbrushes. Just quickly, briefly, before we go on to the third one, we've got about a minute left. I can't believe the show's gone so quick.
I always recommend the Sonicare by Philips. That is my favorite toothbrush, and it always comes with 2 heads. A slightly bigger head and a nice dinky small size head. And I always recommend my patients use the mini size because it's easier to maneuver around the teeth, especially at the back.
Right, okay. And then the last one.
The last tip follows on from our breakfast tip that we were talking about. Now this is all about juicing. A lot of patients are juicing. Everyone's big into juice diets, and I always advise patients, stay away from brushing your teeth for at least 20 minutes after you've had something acidic, because it takes 20 minutes for your mouth pH to neutralize again after you've had something acidic.
Wow, that is a massive tip, listeners. We are at the end of the show. I can't believe it. We've got the news coming up at 1:30. At the full hour. And it's been great having you, Flora.
Thank you so much for having me. I've really had a good time.
It's
I've
been
really
great
enjoyed
to
it.
have
Thank you,
you.
Nicolette.
My pleasure. Listen next week, everybody, for another wonderful guest. And I really hope you have a great week. If you've got anything that you'd like to share with me, at Nico Yoga Pilates or at Wandsworth Radio, go to my website, www.nicolettewilson.com. See you next week. Bye.
We love Wandsworth. Wandsworth Radio.